Mononucleosis is often called as a kissing disease because the virus that causes mono, Epstein-Barr virus, is spread through the saliva. You can get it through kissing, but it can be spread by other ways also. What is mononucleosis? Mononucleosis or mono is a viral infection that causes fever, sore throat, swollen lymph node, most often the neck, armpit. Infectious mononucleosis is defined as a systemic blood infection caused by Epstein-Barr virus. It also known as glandular fever. Symptomatic infection. Highest incidence of typical disease in the age group 16 to 20 years. Uncommon in children and in adults more than 25 years. Higher incidence among children in developing countries and places with low socioeconomic status. Incidence in the population. Estimated at 500 cases per 100,000 inhabitants per year in the USA. What are the causes? 90% cases mono caused by Epstein-Barr virus. Epstein-Barr virus belongs to a herpes virus group. Other viruses and certain infections may also bring on the illness. The symptoms can develop because of adenovirus, cytomegalovirus, hepatitis A, hepatitis B, hepatitis C, herpes simplex virus, human immunodeficiency virus, rubella, toxoplasmosis. Mode of transmission. Mono is contagious. It can be transmitted by contact transmission through saliva by kissing, sharing bottles, straw, eating utensils, toothbrush. Asymptomatic carriers. The virus is excreted through saliva for a long time after the infection, up to 12 to 18 months. It spreads from person to person through contact through coughing and sneezing. It can be spread by intercourse or blood transfusion, but it's less common. Diagnostic criteria. The triad of sore throat, high fever, swollen lymph nodes in the neck, possibly an enlarged spleen. Monospot. Rapid test for detection of antibodies. Positive at the earliest after approximate 7 days of illness. The virus can also be detected by PCR in the early phase. The diagnosis is confirmed by a tighter increase in the Epstein-Barr virus and a blood smear with lymphocytosis and atypical lymphocytes. Medical history. Prodromal symptoms include lethargy, decreased appetite, eyelid swelling, chills, headache, and general malaise. A few days after the onset of prodromal symptoms, the patient usually develops a sore throat and fever. Most people develop swollen lymph nodes in the neck, armpit, and groin. Clinical features. Reduced general condition. In the throat, there can be lymphoid hyperplasia, erythema, and edema. Pus on the tonsils. Patasia at the condition between soft and hard palate in about a third of the patients. Lymphadenopathies, both anterior and posterior cervical lymph nodes. Splenomegaly and or hepatomegaly. Rash. Additional tests in general practice. Hemoglobin, CRP, complete blood count to detect lymphocytosis or atypical lymphocyte. Rapid immunological test, monospot. Epstein-Barr virus antibody test. It is done when monospot test results are negative, but mono is still suspected. And benefit for the doing Epstein-Barr virus antibody test to confirm the diagnosis of Epstein-Barr virus infection. It can distinguish between the recent and past infections, and it helps to differentiate Epstein-Barr virus from other conditions with similar symptoms. ALT can be done, usually elaborated as an expression of, in most cases, mild hepatitis. PCR test can be detect viral DNA early in the course. Ultrasound can rarely be useful in determining whether the liver or spleen are enlarged. Therapy. The goal of treating mononucleosis is to relieve discomfort and prevent splenic rupture. There is no curative treatment for the mononucleosis. Treatment is symptomatic and aims to relieve discomfort. Glucocorticoid or antivirus don't reduce the length or severity of the illness. Rest if the general condition is impaired or liver enzymes are high. Hard physical activity is not recommended for the first 3 to 4 weeks of the illness. Caution with alcohol and other drugs that affect the liver. Paracetamol is the first choice for fever or pain. Drug treatment. No antibiotics or antiviral drugs have been documented efficacy against mononucleosis. If there is fever, muscle pain, sore throat, paracetamol is recommended as the first choice. Ibuprofen can be an alternative. Avoid salicylate, for example aspirin, in young children with fever due to risk of Ray's syndrome. What is Ray's syndrome? Ray's syndrome is a serious condition that causes swelling in the liver and brain. It can occur at any age but usually affects children and teenagers after a viral infection, most commonly the flu or chickenpox. Ray's syndrome is rare, the condition also known as Ray's syndrome. The U.S. Surgeon General, the American Academy of Pediatrician, and the Center for Disease Control and Prevention (CDC) recommend to prevent Ray's syndrome. They advise against giving aspirin or aspirin-containing medications to the children and teenagers. Amoxicillin or ampicillin can lead to measles-like rash and are not recommended for use. In case of pharyngeal edema that threatens respiration, corticosteroid, for example, Solu-Cortef, may be appropriate.